What happens when you quit smoking? Smoking releases thousands of chemicals into your body. The result isn't only damage to your lungs, but also your heart and many other body structures. But even if you smoked for many years, you can reverse these effects and experience health benefits from the first hours you stop smoking to the decades after you quit. 20 minutes after your last cigarette. The positive health effects of quitting smoking begin 20 minutes after your last cigarette. Your blood pressure and pulse will start to return to more normal levels. In addition, fibers in the bronchial tubes that previously didn't move well due to constant exposure to smoke will start to move again. This is beneficial for the lungs. These fibers help move irritants and bacteria out of the lungs, helping reduce the risk for infection. 1 hour minutes after your last cigarette. In as little as 20 minutes after the last cigarette is smoked, the heart rate drops and returns to normal. Blood pressure begins to drop, and circulation may start to improve. 8 hours after your last cigarette. Within 8 hours, your carbon monoxide levels will return to a more normal level. Carbon monoxide is a chemical present in cigarette smoke that replaces oxygen particles in the blood, lowering the amount of oxygen your tissues receive. When carbon monoxide goes away, your oxygen levels start to increase to more normal levels. This increased oxygen helps nourish tissues and blood vessels that were getting less oxygen while you were smoking. 12 hours after your last cigarette. Cigarettes contain a lot of known toxins including carbon monoxide, a gas present in cigarette smoke. This gas can be harmful or fatal in high doses and prevents oxygen from entering the lungs and blood. When inhaled in large doses in a short time, suffocation can occur from lack of oxygen. After just 12 hours without a cigarette, the body cleanses itself of the excess carbon monoxide from the cigarettes. The carbon monoxide level returns to normal, increasing the body's oxygen levels. 24 hours after your last cigarette. By the 1-day mark, you've already decreased your risk of heart attack. This is because of reduced constriction of veins and arteries as well as increased oxygen levels that go to the heart to boost its functioning. Nicotine levels in your bloodstream have also decreased to negligible amounts at this time. 1 day after your last cigarette. Just 1 day after quitting smoking, the risk of heart attack begins to decrease. Smoking raises the risk of developing coronary heart disease by lowering good cholesterol, which makes heart-healthy exercise harder to do. Smoking also raises blood pressure and increases blood clots, increasing the risk of stroke. In as little as 1 day after quitting smoking, a person's blood pressure begins to drop, decreasing the risk of heart disease from smoking-induced high blood pressure. In this short time, a person's oxygen levels will have risen, making physical activity and exercise easier to do, promoting heart-healthy habits. 2 days after your last cigarette. At 48 hours, previously damaged nerve endings start to regrow. You may also start to notice that senses that were previously dulled due to smoking improve. You may realize you're smelling and tasting things better than you were before. 3 days after your last cigarette. 3 days after quitting smoking, the nicotine levels in a person's body are depleted. While it is healthier to have no nicotine in the body, this initial depletion can cause nicotine withdrawal. Around 3 days after quitting, most people will experience moodiness and irritability, severe headaches, and cravings as the body readjusts. 1 week after your last cigarette. The 1-week milestone is important not only for your health but for your success rate in quitting smoking successfully long term. Smokers who successfully make it 1 week without smoking are 9 times as likely to successfully quit. The chances of quitting smoking for good increase with every attempt. If you can make it to 1 week, you can make it for a lifetime. 2 weeks after your last cigarette. Within 2 weeks of quitting smoking, you may start to notice you're not only breathing easier, you're also walking easier. This is thanks to improved circulation and oxygenation. Your lung function also increases as much as 30% about 2 weeks after stopping smoking, notes the University of Michigan. 1 month after your last cigarette. In as little as 1 month, a person's lung function begins to improve. As the lungs heal and lung capacity improves, former smokers may notice less coughing and shortness of breath. Athletic endurance increases and former smokers may notice a renewed ability for cardiovascular activities, such as running and jumping. 3 months after your last cigarette. Within 3 months after quitting, a woman can improve her fertility as well as reduce the risk that her baby will be born prematurely. 6 months after your last cigarette. After 6 months of quitting, many people often notice they're better able to handle stressful events that come their way without feeling like they need to smoke. They may also notice they're coughing up much less mucus and phlegm. This is because the airways are much less inflamed without the constant exposure to cigarette smoke and the chemicals contained within cigarettes. 1 year after your last cigarette. After 1 year of quitting smoking, your lungs will have experienced dramatic health improvements in terms of capacity and functioning. You'll notice how much easier you breathe when you're exerting yourself and how much less coughing you have compared to when you smoked. In addition to these health benefits, you'll have saved a dramatic amount of money. Smoking cigarettes is expensive. If you smoked a pack of cigarettes per day, you'll have saved thousands of dollars at the 1-year mark. 3 years after your last cigarette. In 3 years after quitting smoking, your risk of a heart attack has decreased to that of a non-smoker. Smoking not only limits oxygen flow to the heart, it also damages the lining of the arteries. Fatty tissue starts to build up, making it more likely that a person will experience a heart attack or stroke. Quitting smoking can help reverse these effects and promote a healthier heart in the years to come. 5 years after your last cigarette. Cigarettes contain many known toxins that cause the arteries and blood vessels to narrow. These same toxins also increase the likelihood of developing blood clots. After 5 years without smoking, the body has healed itself enough for the arteries and blood vessels to begin to widen again. This widening means the blood is less likely to clot, lowering the risk of stroke. The risk of stroke will continue to reduce over the next 10 years as the body heals more and more. 10 years after your last cigarette. At the decade mark, your risk of dying due to lung cancer has decreased to that of a non-smoker. The cells that were previously precancerous are now replaced with healthy cells. In addition to decreasing the risks for lung cancer, your risk of developing smoking-related illnesses also goes down. This includes a reduced risk for cancers of the mouth, esophagus, bladder, kidneys, and pancreas. 15 years after your last cigarette. After 15 years of having quit smoking, the likelihood of developing coronary heart disease is the equivalent of a non-smoker. Similarly, the risk of developing pancreatic cancer has reduced to the same level as a non-smoker. 20 years after your last cigarette. After 20 years, the risk of death from smoking-related causes, including both lung disease and cancer, drops to the level of a person who has never smoked in their life. Also, the risk of developing pancreatic cancer has reduced to that of someone who has never smoked. The benefits of quitting smoking. Smoking is a harmful habit that can lead to severe health complications and death. When a person quits smoking, the body will start to naturally heal and regain the vitality of a non-smoker over time. Some effects, such as lowered blood pressure, are seen almost immediately. Other effects, such as risks of developing lung cancer, heart disease, and lung disease, take years to drop down to the levels of a non-smoker. However, each year of not smoking decreases risks and improves overall health, making quitting smoking an excellent choice for anyone who started the habit.